Please note to navigate to the next visit, you will go to the Visit tab at the top right-hand corner of the page. You will not be able to go further into the visit numbers until the principal investigator has signed off on the current visit. There are multiple pages within each visit. You can access those pages here, and you can see for the baseline visit, there are 13 pages total. The first page is diagnosis and disease status. Here you will enter the participant's information on their acute diagnosis. There are a total of 7 study visits, and within each study visit, you'll be able to navigate throughout the multiple pages. For example, in the baseline visit, you'll start off on the diagnosis and disease status form, and you'll move through to complete all 13 of the pages. You will not be able to move on to the next visit until all of the information has been entered into each field of each page within the visit and your site PI has signed off on the visit. Please take note of the fields that populate as you move through filling out each form. For example, under mode of myocarditis diagnosis, if I was to select just clinical, there would be no fields underneath this section. If I select pathological, it's going to ask you the date that the cardiac biopsy was performed and if the cardiac biopsy will be sent to the core laboratory here at the Atrium CC. Once you've completed the form and verified that all of the information you entered is correct, you will then hit submit at the bottom of the page. In the case that you accidentally miss a field, this red X will populate at the top of the screen and inform you that this page has been saved successfully, but you need to correct the following information. And then it will provide you with the field where you missed filling out the remainder of the information. I'm going to scroll down to this field, select the correct answer, and then resubmit the page. Please notice that the page was saved correctly and successfully, and it prompted me to the second page within the baseline visit, which is information on the ICI. To complete this page, you will need to go into the participant's medical record and collect information on the ICI which led to the acute myocarditis. You will enter the ICI therapy drug name, the ICI therapy that was administered, whether it's monotherapy or combination therapy. You'll specify the combination therapy if selected. You will select the setting the ICI was prescribed, the start date of the ICI treatment, and please ensure that this is the start of the ICI treatment associated with the acute myocarditis. You will then select the date of the most recent administration of the ICI prior to the onset of myocarditis. Further, you will chart review for if currently or within the last 6 months if the participant experienced any of the following associated with the use of the ICI. For example, if there's any musculoskeletal symptoms associated with the use of the ICI therapy, it will ask you if each one of these symptoms is current, yes or no. Please be sure to complete all of these fields. Once you've confirmed that the field entries are correct, you will then hit submit at the bottom of the page. You will then move on to the third form. The third form of the baseline visit is the medical history. Please be sure to carefully and meticulously chart review for the cardiovascular history, cardiovascular procedure history, cardiovascular risk factors, cerebrovascular history, renal history, lifestyle use, COVID-19 history. Once you have obtained the medical history information on your study participant, ensure that the date that the medical history obtained has been entered, and you are ready to move on to the next form. The fourth form in the baseline visit includes information on blood laboratory tests. Prior to completing your first patient entry, please ensure that under the Site Management tab, you have filled out the laboratory parameters for your site. If you do not do this prior to entering a new subject, the values and units will be flagged in the form and you will not be able to proceed on to the next study visit. Please enter the date and time of the blood lab tests and enter the hematology and enter the parameters, the liver function tests. Please note that several of the pages within the baseline visit include key information on the inclusion and exclusion criteria required for a participant to meet all of the enrollment requirements for the Atrium trial. A participant will not be randomized or enrolled if they do not meet the eligibility criteria for the study. For example, on the laboratory test results page, the total white blood cell count, absolute neutrophil count, platelet count, absolute lymphocyte count, hemoglobin, ALT, and AST parameters that are listed in the detailed protocol must fall within the range for your participant to be enrolled in the study. I previously discussed the first page of the baseline visit, diagnosis and disease status. Here you will input important information relevant to the myocarditis diagnosis. There are two ways to diagnose myocarditis. One is by pathology. This means that the patient had a cardiac biopsy that was diagnostic of ICI myocarditis. The second way to diagnose myocarditis is through a clinical pathway. In that clinical pathway, the patient has an elevated troponin in either one major or two minor criteria. The major criteria is a diagnostic cardiac MRI. There are 6 minor criteria, and if the subject does not have a major criteria, then they need 2 minor criteria. So for example, you cannot click 3.2.2 cardiac MRI diagnostic for acute myocarditis as yes, and have 3.2.3 suggestive cardiac MRI checked off as yes. While completing this form, if you have any questions about the myocarditis diagnosis information, please go to the help link located in the right upper hand corner of the page, or you can refer to the Atrium Manual of Operations or the Atrium Protocol. Further down on this first page, you will enter information on the ICI history, and you'll have to check if the participant has a history of any of the following prior to starting ICI. You will then enter information on prior cancer therapies, anthracycline, and then if you select yes, you'll need to select the type. Once you complete the rest of the page, please hit submit. And once you hit submit, again, it will bring you up to the top with any corrections you need to make in the form. Please also know on the first page of the baseline visit, the diagnosis and disease status page that we previously discussed, the information on the acute myocarditis diagnosis information section includes some inclusion criteria that is required for study participation. The troponin elevated question and was the value greater than or equal to 5 times the upper limit of normal are inclusion criteria for the study. Further, the study participant must meet at least 2 of the minor clinical criteria or the major clinical criteria required for the myocarditis diagnosis. Moving on to the 5th page of the baseline visit, here you will enter serology information on hepatitis B, hepatitis C, and tuberculosis. Please note that any active, chronic, or recurrent viral infection that, based on the investigator's clinical assessment, makes the participant an unsuitable candidate for the study, which may include the following listed on the page here. The 6th page of the baseline visit includes information on the physical exam. The physical exam should be performed prior to this participant enters visit 1. Here you'll need to record the date of the physical exam and if any findings were present that would prohibit administration of the study treatment. Please enter a comment into the field here if you selected yes. Again, once you are done entering the data, you'll need to hit submit. I'm going to review briefly some of the icons that are listed at the bottom. The A is an audit trail, which flags the history of changes if an item has been updated. You will be able to see these icons listed in the electronic case report form overview listed in the main menu. Here you can see that the A is listed next to the 4 data entry fields, which means that there has been a history of changes and the items have been updated. Please update items if you see a posted data query, which means the data item requires clarification. The 7th page of the baseline visit includes information on the echocardiogram. An echocardiogram should be performed at baseline and at visit 5, 28 days after the first infusion of the study drug. It is anticipated that an echocardiogram will be performed prior to the administration of study drug, and in the majority, as an echocardiogram is a standard test for the assessment of myocarditis. The baseline echocardiogram can be performed within 10 days prior to randomization. Please note that the echocardiogram images will be de-identified and uploaded here to the EDC system. On this page, you will enter if the echocardiogram was performed at baseline, if so, the date it was performed, the recorded EF measurement. Here you will also be required to upload the DICOM images using the paperclip that's next to the date field. Please ensure that these images are de-identified prior to uploading to the EDC. Similarly, you're going to enter information if a cardiac MRI was performed. Here you'll select yes or no. If you select yes, the date will populate, and again, you will need to upload the DICOM images that have been de-identified by your site to the paperclip located next to the date. A cardiac MRI is typically performed as part of standard of care to help in making the diagnosis of myocarditis. The cardiac MRI is not required as part of the study, but is a standard diagnostic test for myocarditis. It is anticipated that a cardiac MRI will be performed in the majority. The timing of the baseline cardiac MRI can be performed at any time during the index assessment for myocarditis. The 9th page is information on the 12-lead ECG. Similar to the previous 2 forms within the baseline visit, you will answer if the ECG was performed. If so, you will enter a date and upload a PDF version to this paperclip here. And please ensure that this PDF is also de-identified. The 10th page of the baseline visit is the concomitant medication page. Here you will enter data on the medications prescribed at the time of randomization. For the first two, ACE and ARB, if you are unsure what the names of these medications might be, you can scroll over to the right-hand Help tab. When you select the Help tab, this will bring you to the Help for Baseline Visit page, and it will show you a list of the medications you can chart review for. Please also note that the medication of interest list can be found in the Atrium Manual of Operations. If you have a medication of interest, you will select the blue hyperlink at the bottom. This will bring you to a form where you enter the medication name, the route, the daily dose, unit, and start and end date. Please note that concurrent or recent within 2 months of the following non-corticosteroid immunosuppressive therapies listed in the Atrium Detailed Protocol are also part of the exclusion criteria for the Atrium trial. To return back to the baseline visit, once you completed and submitted this form, in the case that you need to submit this form for your study participant, you will then proceed back to the baseline visit, select the following page. The 11th page is the Quality of Life survey. Here you will enter the following questions based on the responses from your study participant. These responses must be entered directly into the EDC form listed here. Please be sure to enter the date that the study participant responded to the questions in this form. You will see this form again at the final follow-up visit with your study participant. The last 2 pages of the baseline visit include information on the inclusion criteria and exclusion criteria. Here on the 12th page is the inclusion criteria, in which you will review that the participant falls within each one of these parameters. At the top, you are going to record the date the assessment was performed. Please be sure to carefully review each one of these questions and to select the yes or no box. You will then hit Submit at the bottom of the page. The last page of the baseline visit includes the exclusion criteria. Please select yes or no for each one of the questions. Please be sure to carefully review each one of the exclusion criteria prior to submitting the form. Participants who meet any of the following criteria listed on this page will not be eligible to participate in the Atrium trial. Once you complete the inclusion and exclusion criteria pages, you have now completed the baseline visit. Your site investigator will need to log into the EDC and sign off to verify that the information entered is complete and accurate. Once you complete the randomization page, your site investigator will need to go into the EDC and sign off on the page. Once signed off, your participant will receive a study vial number, the date of study drug allocation, and the name will populate who the allocation was performed by. The research laboratory sample collection page includes information on the blood sample collections for each study visit. Please note that research samples will be collected at visit 1, at visit 3, at visit 4, and at visit 5. Research sample collections will not be done at visit 2. For more information on the research sample collection procedures, please refer to the Atrium Lab Manual or the Atrium Manual of Operations. Here on this form, you will enter if the research blood draw was done prior to administration of the study treatment, and then you will record the date and time the sample was collected. Here you must also record which of the 4 research samples were collected. Please again refer to the protocol, the lab manual, or the Atrium Manual of Operations to see which research samples are required at what study visit. At visit 1, all 4 research sample collections are required. If for some reason you are unable to obtain a sample, please write the reason in this box on the page. The 5th page of visit 1 includes information on dose 1 administration. Here you're going to record if abatacept or placebo was administered. If not, you're going to record why. You'll record the date, the start time of administration, the stop time, if the infusion was interrupted. If you select yes for question 5, please be sure to include a reason for the infusion interruption. You will then record the total amount infused. Please note that any adverse event during visit 1 must be recorded in the adverse event form located in this blue hyperlink. Here, you can go to select Add AE, and it will bring you to the adverse event page in which you enter the event type. And then you are going to enter if the infusion meets any of the following: an infusion-related reaction, infection, immune-mediated adverse event. You will then record the onset date, onset time, severity grade, and if it's related to study treatment, and if so, action taken with study treatment. If it's not related to the investigational product, you will write the reason for the AE here. And if this is related to any medications of interest, please again refer to the medication of interest form, and you will also need to submit the outcome here. Please write a brief synopsis of the adverse event in this box under narrative. If you have any questions regarding an AE, please contact the Atrium CCC or a medical monitor if it's urgent. Once you complete the form, hit submit. And here you will verify if there's been any events since